What can a family do if there's a traumatic injury? Well, if you're at the scene, you can call 911. Almost throughout the entire country, 911 is immediately available. In our county, they respond immediately. They come out to the scene. They're very experienced. They know just what to do. They can make the scene safe. They can extract the patient, and they know where to bring the patient. The other thing that the family members can do is to be supportive of the family member, of the injured one. It's been shown that if you have a supportive family, your outcomes are better. It sort of only makes sense. There's not just the physical injury, there's the impact and all the rehab, and if a family member is there, we're so much happier when we see supportive family members and the patients do better. We have people that are involved with the family throughout the trauma treatment. The trauma is interesting in that there's no warning. Everything is fine 1 minute and it's an utter disaster the next. There's been a car accident or a gunshot wound, or you're working on the roof and you fall 30 feet. So the 1 second you feel great, and the next second it's a catastrophe. So what do we do to help the family members? We have social workers on every day that can interact with the family and help them navigate the complex scenes of rehabilitation, through the hospital stay, through the long-term care, through the home health. We also have a psychotherapist involved. There's so much stress, not just with the family member, not just with the patient, but with the family members. So it can help to be able to talk to a psychologist. And the nurses are also specially trained in order to help the patients deal with the difficulties. Interestingly, you think of trauma centers, maybe the average stay is really long, but it actually is not. The average stay in a trauma center is 3 days. So if a patient cuts a major vein or artery in their body and they're bleeding to death, and if they don't get the help, probably die in the next few minutes, you come to the trauma center, we stop the bleeding, we resuscitate the patient, maybe they get blood transfusions. Average age is only around 40. So the 40-year-old can really take quite a bit of punishment and respond and get better. The bleeding stopped, they go to the operating room, they'll only end up spending frequently a few days in the hospital. So the average length of stay is actually only 3 days in a trauma center.